The Body Shop with Meredith McDonough and Dr. Steve is brought to you by Allegheny Chesapeake Physical Therapy.
Good evening and welcome to this week's edition of The Body Shop with Dr. Steve. I'm Meredith McDonough. This week's topic, knee replacements. All right, so Dr. Steve, how do you really know when you're a candidate for a knee replacement? Is the pain that bad? How are you supposed to know?
Thank you, Meredith. Until recently, the best decision or the decision to have a total joint was really left up to the patient. The patient was told, yes, you have osteoarthritis, you're a candidate for a total joint replacement, you'll know when you're ready. And they kind of knew when they were ready because of pain. They just couldn't function anymore, they couldn't do what they needed to do, and then they said, I just can't tolerate this anymore, and went and had the total joint.
Okay. Now, Dr. Steve, you said until recently. Why do you say that?
Well, until recently, because now there's some research and data that can predict some outcomes.
So, Dr. Steve, does this data then exist now?
It does. Meredith, there are tools that we use to grade someone's disability, figure out what their loss of function, ability to do things during the day. Many of those tools have been used over the years, but there's now research that says if you take this one tool, which is called a WOMAC, and you do that disability measurement, that tool, if you fall and score into the lowest quarter of that score or that test, it actually would suggest that you won't do as well following a total joint replacement. In the past, it was always left up to the patient. Now we have some more tests that we can actually apply, have the patient fill out this questionnaire, have it scored, and when it's scored, we may be saving you from having not as good of an outcome from a total knee replacement. I don't want to infer that total knee replacements aren't successful. They are. But your success getting back to functioning and doing things is much better if you don't fall in that last quarter, that lower score. We can score them and say, you know what, you're a candidate, you're heading towards that lower score, you need to go get that total joint replacement now.
Okay, Dr. C, so you're saying by having patients fill out this disability test that you may even be able to predict when they should have the surgery and the success of it.
Correct. It's a predictor as to when you want to get to have surgery and avoid having a poor response. So the disability index with the x-rays really is a combination to then say, okay, this is the best time to have that surgery.
Okay, can you explain now the role of the x-ray, how that plays a part in this?
X-rays tell you the status of the joint, how much arthritis is in there. But if you took 10 x-rays and you put them up on a view box and looked at them, you could see one that has severe degenerative arthritis. But what that doesn't tell you, and that tells you you're a candidate for a total joint replacement, but what it doesn't tell you is what that patient looks like. Because you can have terrible arthritis in an x-ray but fairly good function, or you could have a minimal amount of arthritis and have a big disability. So the combination of those two is really the key to making that work as far as determining when the best time is to get the total joint replacement.
Okay, so I guess really lastly, just what's the best advice then for patients at home that are wondering if they need this joint replacement?
If they're wondering whether they should get a replacement or it's time, they can just ask for a disability index. It's called a WOMAC. They can stop in any of our offices or they can go to their healthcare practitioner and just say we would like a WOMAC so that we know where we stand. It's fairly easy.
As always, Dr. Steve, thank you very much for filling us in on the joint replacements, and I think you're informing a lot of people out there. So thanks to Dr. Steve. If you have any questions at home, all you have to do is contact Dr. Steve at 1-800-332-5740 or log on to www.alleghenychesapeake.com. Thanks, Dr. Steve.
You're welcome.